Namaste to all. I am Dr. Utkarsh Karki, child and adolescent psychiatrist currently working in the Child and Adolescent Psychiatry and Mental Health Center at Kanti Children's Hospital, Nepal. First of all, I would like to thank the organizing committee for selecting my abstract in this 16th International Congress on Psychiatry and 4th International Congress in Child and Adolescent Psychiatry. The topic for today's presentation is Child and Adolescent Psychiatry Training in Nepal, Early Career Psychiatrist's Perspective. So to begin with the introduction about postgraduate psychiatry training, the first course or training for postgraduate psychiatry was started in 1997 at the Institute of Medicine, Maharajganj in Nepal. And at the moment, there are around 20 medical institutes or colleges where undergraduate training is conducted. And out of those 20, only 12 of the institutes run psychiatry training program, and there are no medical institutes which run a designated child and adolescent psychiatry training program. And also the psychiatry training program that is being run are very different, and there are no uniformity in the sense that they are conducted under different universities, and the consistency and uniformity in the training program is not present. So Nepal being one of the low-income countries in South Asia, lack a lot of factors in relation to child and adolescent psychiatry and mental health, and the bridge between the demand and supply is enormous. And in a country like ours, we have around 45 to 50% of the population who are under 18 years of age. So the demand for child and adolescent mental health services is significantly high. So like I already mentioned, CAP services and training provisions are confined to only few centers. And these are centers which provide the basic child and adolescent mental health services in terms of running an outpatient department or outpatient services. But there is no institute which run a dedicated CAP training program, and no specialized postgraduate CAP training is there in the entire country. So our aim and objective of this study or this survey was to identify the current status of CAP training, the shortfalls, and to explore the training experiences of Nepalese early career psychiatrists. This was an online survey, and the participants that we involved were early career psychiatrists in Nepal. By early career psychiatrists, I mean the psychiatry trainees who were undergoing their training program for a duration of 3 years, and psychiatrists within 7 years of specialization who would have or who had completed their Doctor of Medicine or master's degree in psychiatry, that is a 3-year intensive and comprehensive course in psychiatry, which is run in various institutes or various medical colleges in Nepal. And this was an anonymous online survey. The participants were contacted through email using a Google form, and a uniform resource locator was sent to them. And prior to that, we involved and we contacted the members of Psychiatric Association of Nepal at different cities and towns, and through them we managed to reach out to these participants. And the survey period was from 1st of January to 1st of April 2019. And also a consent form was sent along with the Google form, and answering the responses were considered as consent and permission for the study. So the study results were expressed with descriptive tools like frequency, percentages, and mean and standard deviation. The questionnaires consisted of 20 questions, out of which it included description of the respondents, whether they were psychiatry trainees or they completed the psychiatry training. Also, we wanted to know about the CAP training characteristics and their self-evaluation of how they perceive their child and adolescent psychiatry training, and finally their opinions on additional CAP training. So the questions were basically of 3 types. They were single and multiple choice questions, followed by open-ended questions also, through which we wanted to know the desire or their wish to further continue with CAP training, or they wanted to pursue CAP as a professional and as a future career. And finally, we also had 3 questions, which was a Likert scale on a 10-point agreement ratings score, wanting to know their confidence in diagnosis, management, and overall confidence. So coming to the results, we contacted or we emailed 92 early career psychiatrists, and out of which 77 of them responded to the survey. So the response rate was around 84%, which is okay. And then out of these, psychiatric trainees were 32 and MD psychiatrists were 45. And among these participants, 41% of them responded that they received CAP training, and 44% of MD psychiatrists who completed the training also responded by saying that they had received CAP training, but more than half of them had not received any CAP training. Coming to the description of training characteristics, as we can see in the left table, so there was around 1/3 of them who responded that they did not receive, or they had very minimal or no formal training. So this finding was quite alarming, and majority of them had their CAP training through case presentations and clinical postings for around a period of 2 weeks to 1 month. And most of the respondents replied that their institute where they were trained did not have a dedicated CAP unit or department. So almost 70% of them did not have a dedicated CAP unit or department. However, the number of CAP patients they were seeing per week, you can see that 62% of them were seeing around 1 to 10 children and adolescents per week. And most of them did not, they often suspected that the children they were seeing had childhood psychiatric disorder. So they had some understanding about children and adolescents who were coming to their OPDs. Looking at the confidence or their self-rating in terms of how they perceived their confidence in diagnosis, confidence in their management, and overall confidence, which was assessed through a Likert scale, 0 to 10, where 10 being the highest possible score. So majority of them had a below average score in all of these assessment of their training in child and adolescent psychiatry. Also, their respondents' CAP training rating, where they had rated how they perceived their rating, almost 2/3, which is quite alarming. 2/3 of them responded that their CAP training was very limited, and also some of them rated that their CAP training was grossly inadequate. But it is encouraging to see that 74% of them wanted additional CAP training. So this is quite encouraging, and we can advocate, we can educate, we can include early career psychiatrists and psychiatry trainees at their early professional period in terms of exposing them to child and adolescent psychiatric cases where they are part of the multidisciplinary team, and where they can see good treatment outcomes in children and adolescents when they train themselves, when they're exposed to child and adolescent psychiatric cases. So the open-ended questions through which we wanted to know their further commitment or further interest in child and adolescent psychiatry, majority of them responded by answering that they would like to have, or they would like to pursue short-term fellowship courses. They would like to also participate in psychotherapy and psychological intervention training, and they would want more and regular continued medical education programs in their career. Having said that, there are several limitations to this study. The first limitation is it was a subjective assessment, and the respondents' training and clinical experiences and skills were not assessed objectively, and no information was obtained directly from the training program in each institution. And also the way in which the respondents interpreted the intent of the questions could have differed in each individual. And more qualitative exploration would have provided us with a greater insight and understanding of CAP training and its shortfalls. Finally, coming to the conclusion, despite this significant exposure to CAP patients in daily practice, like I mentioned, 62% of them were seeing around 1 to 10 cases per week. ECPs or early career psychiatrists evaluated their CAP training as insufficient. So this is quite alarming, and the desire of early career psychiatrists to receive additional training in CAP is highly encouraging and positive. And we would like to recommend and advocate for proper implementation of CAP rotation and incorporation of CAP training in the current psychiatric training, and be a feasible option in Nepalese context to address this unmet training needs. So as of now, in Nepal, we are only 3 child and adolescent psychiatrists. And if we look at the ratio of child and adolescent psychiatrists per 10,000 children below 14 years, the ratio is only 0.01. So it is very important, and this study also gives an insight to us, to those who are, to the stakeholders who are involved in developing training and curriculum programs for psychiatry trainees, to incorporate child and adolescent psychiatry program and training in the larger picture of their psychiatry training. So thank you for your kind attention. And this study was conducted by myself, Dr. Yogesh, Dr. Gunjan, Dr. Isha, Dr. Preeti, Dr. John, and Dr. Shekhar. And if you would like to contact me for further information and more details, please feel free to mail me at the below mentioned email ID. Thank you. Namaste.